Well, hi everyone who's in so far. We're just going to give it a minute or two just to let everyone join and then we'll kick off. Okay, that's great. Okay, so I think we'll kick off and we'll let a few people join in then. So hello everyone, welcome to tonight's webinar and thank you all for joining. My name is Katie and I'm in the communications team here at SIMS, and tonight I'm joined by Oriel from Access Fertility. So I'll just give you a quick and brief intro into SIMS before I hand you over to Oriel. And if you have any questions throughout tonight's webinar, if you want to pop them into the Q&A, we'll do a Q&A session at the end and we'll go through all your questions. So at SIMS IVF, we have 7 clinics here in Ireland. We have 3 main clinics located in Clonskee in South Dublin, Swords in North Dublin, and a main clinic in Cork. And with that, we have 4 satellite clinics in Dundalk, Carlow, Limerick, and we have just recently opened a new satellite clinic in Wexford as well. SIMS IVF is part of the Versus Health Group, which is one of the leading fertility groups across the world. It's a global group, so we get to share a lot of experience and knowledge from around the world, and this ensures that our patients get access to some of the best care and expertise across the globe. At SIMS, then, we offer a range of treatments such as fertility testing, IVF, ICSI, donor sperm programs, and we do genetic testing options such as PGTA, PGTM, and PGT-SR. With that, we also have a range of options for those embarking on solo motherhood and options for same-sex couples as well. With that, we have a lot of relationships with different partnerships, and one of those is Access Fertility. So I will hand you over to Oriel and he'll take you through tonight's webinar about the Access Fertility programs that are available for patients in Ireland.
Hi, everyone. Well, thank you, Katie. Well, my name is Oriel. I work for Access Fertility, and today I will be doing a presentation about what can we offer you and all the benefits of using Access Fertility programs. And as Katie mentioned before as well, after the presentation, if you have any questions or anything that you would like to discuss or ask, we can do it at the end of the presentation. So what is my role in Access Fertility? So I'm the clinic manager. So I'm this middle point between SIMS and Access Fertility. So anything that the clinic might need, I'm the point of contact to help and to provide to them and to discuss it with them. And before we go with or explain everything about the programs and everything we can offer you, I think I will explain a little bit more who is Access and where we are coming from. So Access Fertility is a company that was founded back in 2014. So it's been 11 years since we start partnering with clinics. Back then, we started partnering with 5 clinics in the UK. And fast forwarding until today, Access Fertility is the largest private funder of IVF in the UK. And we partner with over 70 clinics in the UK, Ireland, and other countries in Europe. So other countries that we also partner with Portugal, Spain, Poland, and Greece. But our main markets at the moment are UK and Ireland. I will go through the programs we offer in a second, but 2 of the biggest benefits that our programs offer are the refund. So if you don't have a baby after completing your program, you will get a percentage back of what you paid for the program. And also another benefit that the program offers is that all transfers that you will have under the program, when I mean transfers, I mean embryo transfers, will be included within the fee that you paid for the program. It's a fixed fee, and it will not have any limit of transfers included. Just to show us some numbers of Access Fertility over these 11 years that we've been offering these programs, we have refunded over £60 million and euros to patients. Also, we have offered over 30K treatment cycles to patients, and the one that it's that we are more proud of, we have helped to have over 10,000 babies born to patients using our programs. Great, so let's go ahead for the programs we offer at all SIMS clinics. Just to mention before we go ahead, that these programs are available to all the SIMS clinics that Katie have mentioned. So, and all of them, they have the same pricing. So if you have questions about the pricing or anything more specific for a specific clinic, we can go through that at the end of this webinar, or please contact the clinic afterwards and we can provide more detailed information. So the first program, the first program is a refund program. This program is using your own X. It will offer you up to 100% refund. It offers actually a range of percentages. So there will be 3 options: 50% refund, 70% refund, and 100% refund. The program will offer you up to 3 egg collections with 2 options available: 2 egg collections or 3 egg collections. If you complete the program without having a baby after completing all the egg collections included on your option, you will get the percentage back that we have agreed previously. So for example, if you're under the option of 3 cycles, 3 egg collections with 100% refund, if you complete the 3 cycles without having a baby, then you will get the 100% back of what you paid for the program. Just to mention about this refund, the process for the refund is very easy. It's very quick. Usually we process this refund in less than 30 days, and we try to make all this process. When I'm saying the process, is not just for the refund, but all the enrollment process and the treatment process and the refund process as easy and stress-free as possible. Also, the program offers unlimited transfers. That means that all embryos created under the program, the transfer, either if it's fresh or frozen, will be included. And there is no limit on transfers. So let's say that on your program, you've got 5 embryo transfers, all of them will be included. If you've got more than that, all of them will be included. It will not change the fee. Also, the program offers fixed fees. That means that you will know how much your treatment costs before you start the treatment, and it will be a fixed fee for 2 or 3 cycles. And the payment for the program needs to be done before you start the treatment. So before anything, you will know how much it costs, and it will reduce the financial stress on the IVF treatment. The IVF treatment per se, it's already stressful. So helping on the financial side and reducing the stress on that side, it's a good thing as well to go ahead for an IVF treatment. And the last thing is for the refund programs, there are options available for patients under 40 years old. A couple of things more to mention about the refund programs. The initial consultations, pre-screen tests, such as the AMH, or semen analysis, and the medication are not included. So all of that will have to be paid directly to the clinic, and it will not be part of the program and their inclusions. And also, this option is subjected to medical review. This medical review can take up to 2 weeks to be completed, but the patient doesn't have to do anything. So the first step always is to have the initial consultation with the clinic, to provide all the information that they require, or complete the test that they're missing to do. Once you've done that, we can start the registration with Access, and then we will deal all this medical review directly with the clinic. So they will provide information to us. Our medical team will assess this information, and we will provide the outcome directly to you. Great. So we've seen already the first option, which is the refund program. We have another refund option. This is called unlimited refund program. The main difference with this program is that it's not cycle based. So it's not like you will have 2 or 3 cycles. It's more time based. So that means that you will get unlimited cycles of IVF for a period of 2 years. If after these 2 years you even have a baby, then you will get 100% back of what you paid for the program. This program also offers unlimited transfers. That means that any embryos that you create under the program, they will be covered by the program. Also offers fixed fees, so you will know the cost of the program before starting the treatment, and options available to any patient under 38 years old. In terms of exclusions, exactly the same. So initial consultations, pre-screen test, and medications are not included. And as this is also a refund option, you will be subjected to medical review. And as the same as the other refund program, it will be dealt directly between Access and the clinic, and it can take up to 2 weeks to be completed. We've seen option number 1, which is the refund program. Option number 2 is the unlimited refund program that it's time-based. And we have now option number 3. Option number 3, it's called multi-cycle program. This is the option that it doesn't offer the refund element, but it offers the treatment at discounted rate. Because it doesn't offer the refund element, the cost of the program, it's lower as well. But in terms of benefits of the program, it offers exactly the same benefits. So the treatment is at discounted rate. It offers options. It offers up to 2 collections and unlimited transfers of embryos. So in terms of all the inclusions and exclusions are they will be exactly the same as the refund options. The program will offer fixed fees, which means that, again, that you will know the cost of the program and your treatment before starting anything. And this option offers options for patients under 45. As the program doesn't offer the refund element, there will not be any medical review. So any patient under 45 years old will be 100% accepted for this option. In terms of exclusions are exactly the same. So initial consultations, pre-screen tests, and medications are not included. Great. So in this slide, probably some of you already know how a cycle works, but it was just more to show how a cycle will work within the program, which is more or less the same how it will work like if you go directly with the clinic. I just wanted to highlight that batching, which is having egg collections back to back, collect all the embryos from the different egg collections and then transfer them, will not be allowed under the program. How the programs work, it's that you will have to go cycle by cycle. That means you will go through the first egg collection, those eggs will be fertilized with the sperm, then hopefully the embryos will, some embryos will be created, and then you will be transferring those embryos. Once you have no more embryos that they're suitable for transfer available at the clinic, then it's when you can start your next cycle. Okay. Also, I know I'm doing these webinars because I'm explaining a lot of things and it feels like I'm giving away a lot of information. Please feel free as well after to ask as many questions as you want, or if you would like as well, I will give the web Access Fertility website at the end, so you can go there. You can add, you can have a contact form, fill all this information there, and we can give you a call anytime, and we can go in through all the details with you. Great. So I'm a visual person, so I need to see how it looks like, how the things look in a visual way, because sometimes saying the things out loud but not seeing them, it can make some confusions and everything. So I just put here like how the patient journey will be throughout the whole process, since the first contact until the program is complete. So there will be always two ways. Some patients, they will contact Access Fertility first, and then they will contact the clinic. Or there will be some patients that they will visit the clinic, they will get in Access Fertility information, and then they will contact Access Fertility. Either way, once the patient had the initial consultation with the clinic, then it's when they can contact Access to start the registration for the program they would like to enroll. This registration can be done either via email or with the phone, whatever the patient prefer. And during the registration, we will register you in our system, and we will create your profile in our portal. After that, if you apply for a refund option, we will start the medical review, which is what I explained before, that we will contact the clinic to ask for your medical notes. Our medical team will review this information, and then they will complete an assessment, so we can give you an outcome of your medical review and let you know your eligibility for the refund options. After that, if you would like to go ahead for the options that you have available, we will send you through your portal the contract, which we call it as well agreement form, which you will be able to review, and if you would like to go ahead to sign it. All the forms that you have to review and sign there electronically, which means that you don't have to download or to scan or to sign or to post anything. Everything is signed digitally, and it's very easy to use. Once you sign the agreement form, you will be able to make the payment for the program. And after the payment has been received, we will contact the clinic and we will authorize your treatment to the clinic, which means you will be able to start your treatment. Hopefully, this treatment will be finalized with what we all of us want, is for you to have a baby. But in those cases, for those patients that they applied for a refund option, and unfortunately and sadly that's the case, that they didn't have a baby, then they will be able to claim the refund, which, as I said before, it will be a stress-free process, and we will be helping as well with all the steps to claim for the refund. Now, just to finish a little bit with a couple of things, I just put a few questions or common questions that patients have. The first question is, can the patient have additional services not covered by Access Fertility? The answer is yes. We do not interfere with any treatment decisions. Katie before mentioned, for example, about PGTA, that it's the biopsy that the clinic does to the embryos. This biopsy, for example, is not included within the program, but if you require to do this biopsy, you can do it and pay directly to the clinic. The program will cover everything that is considered standard on an IVF treatment. I would say that covers the majority of the things, plus it offers the unlimited transfers. Yeah, during the process of the registration on the agreement form, you will have a full detailed list of all the inclusions and exclusions, and myself and the rest of my team as well, we will be always happy to help with all your questions before enrolling, and to make sure that the decision you take, you feel 100% sure, and you feel like you understand every single bit of the program and the treatment that you will have. Are your programs compatible with the shared motherhood? Another thing that Katie mentioned before. So yes, shared motherhood is compatible. The only option that is not compatible is the limited refund program. But if you would like to use shared motherhood, you can do so applying for the refund programs and also the multi-cycle program. And that would be it. You have here our email address, which is support@accessfertility.co.uk. Also, our phone number to contact us if you would like to speak with one of our patient advisors, and our website. On this website, you have all this information I've explained. Plus, you can fill up this contact form with all your questions, and we can go through that also via email or over the phone, as you prefer. Um, Also, you can find out more information on the SIMS website. And yeah, well, please let us know if you have any questions now that we can have a look.
Thanks, Oriel, for going through all that. That's great. Really useful information to break down the programs and go through like that, how they're structured so visually is really helpful. So I'll just have a look if we have any kind of questions in, and as well, if anyone has any questions that they prefer to discuss offline as well, we're quite happy to do that as well. If you want to email or contact Access Fertility directly or contact SIMS directly as well, and we're happy to discuss anything if someone doesn't want to ask online. That's also totally fine. So we have a couple of questions in, Oriel, here. So someone has asked, is it possible to have a gap between cycles, and is there a limit to the amount of time between cycles for the programs?
That's a very good question. So the only program that has a time limit is the unlimited refund program. So this is the program, the option number 2. And this option, you will have unlimited cycles for a period of 2 years. For the other 2 options, so the refund program that offers 2 or 3 cycles, or the multi-cycle program that is the one without the refund element, there is no time limit. So you can take as much time as you need to complete your program. If you require a year between cycles, that's not a problem. You can take as much time as you need.
Brilliant, that's great. And we have another question in as well about the kind of, you were talking about the medical review and things like that. So are there any qualifying limitations for acceptance to the program, such as AMH levels, or do you have any BMI restrictions?
Another good question. So in terms of medical review, we don't have a set criteria. So we try to check all the information possible. So information that we will check will be all the testing information, such as the AMH, the AFC, the semen analysis, all this testing that you prior have done before starting your cycle. We will check medical information that could be useful for your treatment, and also any previous IVF treatments that you have done. The reason why I say we don't have a specific criteria, it's because we don't want to be, for example, oh, this is the AMH, then you are 100% not qualified for the refund options. We try to understand the whole picture. So maybe the AMH will be slightly lower, but the rest of the information, it's also positive. So patient can be anyway eligible for the refund options. Anyway, bear in mind as well that the multi-cycle, if you're not eligible for the refund options, there is the multi-cycle program, which sometimes it sounds, oh, there is not the refund option, it looks better or looks worse. It's exactly the same. It offers exactly the same benefits. The only difference is the refund element, but also in the other side, the cost of the program is low as well.
That's great. That actually leads on to the next question nicely. Someone was asking for that and related to the multi-cycle, kind of what were the benefits of that compared to the other cycle. And I think, as you've outlined there, despite no refund, it's a cheaper program, the lower cost program to go into. I'll just have another look now and see. So you did mention as well about you don't do the embryo batching. Is there other solutions for that?
So, for example, if you're looking to do embryo batching, if you had embryo batching recommended for your treatment, unfortunately, your treatment will not be suitable for Access Fertility programs. But if you are not seeking to do embryo batching, or embryo batching is not mandatory and you would like to use our programs, then at the end of the day, you will have the treatment at discounted rate. Also, one thing that it's also good to know is you can withdraw from your program at any time. So, for example, sometimes you might not know if I want to do embryo batching, or I don't want, or maybe they recommend it, but they are not sure. You can start an enrollment with Access Fertility, and if on doing, for example, the first cycle, the clinic diagnose that embryo batching would be the best option for you, and therefore is not longer compatible with our program, so you can withdraw, and the whatever has not been paid yet to the clinic, so the remaining amount will be always refunded to you. It's not like you pay this fixed amount at the beginning and then this amount will not be like you will not see anything unless you're in a refund option and you complete and successfully the program. No, if you decide to withdraw any, we will calculate the amount that has not been paid and will be refunded to you.
And that's great. Thanks, Oriel. And again, just to touch off the multi-cycle program, just to make it as well clear, you know, as you've mentioned, there's the no refund element on the multi-cycle. Would you be able to talk through the benefits of going with the multi-cycle and what the difference is? Just that there's no confusion as to why someone would choose that.
Of course. Well, I mean, I would like to start saying first that we could just offer only one option, say this is the option and that's it. But we want to offer options for everyone. There might be some people that they don't feel that the refund option would be for them because they don't care much about how much they will get back if that doesn't work out. They prefer the lowest cost possible. So that's why we offer as well the multi-cycle. What we always want to offer with our programs is the maximum quality and the maximum commitment possible. So that's why all of our programs offers exactly the same inclusions and exactly the same exclusions. In terms of the multi-cycle program, there are a few things to highlight. So the first thing is that there is 100% acceptance rate. So that means that either if you apply initially for the refund program, but then you're ineligible, you cannot go ahead for the multi-cycle program, or if you want to go ahead with the multi-cycle program directly, you can and you will be 100% eligible. Also, some patients for the medical review, they might feel slightly stressed and they would like to be less stressed just applying for the multi-cycle program and being accepted 100%. So that's another thing that the multi-cycle program can give as a benefit to patients. I would say as well that the refund program offers options available for patients under 40, while the multi-cycle program is available for patients under 45. So, for example, any patient who is between 40 to 44 years old can still apply for the multi-cycle program and can take as much time as they need to complete their program. Also, the multi-cycle program, I would say, because there is no refund element, is the most flexible program. If you want to take big long breaks, that's not a problem. If you would like to, for example, make the payment but then don't start your treatment in a year, that's completely fine. So the multi-cycle program, it's because the cost is low, shouldn't be seen as it will offer me more, it will offer me less. It will offer you exactly the same, but it's an extra option available for you. And we want to offer options that for people, for everyone, and everyone will choose whatever they feel more appropriate for them or more suitable for them.
Thanks. And I think as well, Oriel, you can correct me if I'm wrong, but just to be clear on it, the other program with the multi-cycle it is a cheaper, a lower cost alternative. Is that correct?
That's correct.
Compared to the refund.
So, yeah. So just to be transparent and clear, also the fact that if you contact SIMS after today's webinar, or if you contact Access, we will be able to provide with all the the most up-to-date pricing. But you will see that the program with the higher cost, it will be the limited refund program, as it offers a limited treatment for a time period of 2 years. Then the refund options, depending on the number of cycles and the percentage of refund, it will have higher or lower cost. But then the multi-cycle program, it offers exactly the same inclusions and exclusions, offers as well 2 cycles, but because it doesn't offer the refund element, the cost of the program is slightly lower compared to any of the refund options.
That's brilliant. Thanks, Oriel, for going through that. Now there is another question in, and it relates to the public side of things as well. So now, again, you can correct me if I'm wrong, but I believe this can only be used with, say, a clinic that's affiliated with Access Fertility. So someone has just queried if they've received treatment through the fertility hub and they wanted to go with Access. Do they need to continue IVF through the fertility hub, or can they go ahead with SIMS or Access Fertility? I think they would have to go to the private clinic or one of the affiliated clinics with Access. Is that correct?
That's correct, Katie. So in order to use our programs, they need to be through any of the clinics that we partner with. So for example, if you would like to use any of the SIMS clinics that Katie had mentioned before, you will be able to use any of our Access Fertility programs. But any other clinic that we don't partner with, unfortunately, we won't be able to offer our programs.
Great, thanks for that. And for any of the programs that a patient may choose to opt for, in terms of the payment element of things, does that need to be paid upfront fully, or do you offer installment payment options for this?
That's a very good question as well. So at the moment, patients needs to pay for the program upfront before starting the treatment. If patient, for example, wants to find finance options outside of Access Fertility, that's completely fine. That's not a problem. But in terms of completing the enrollment and making payment, that needs to be upfront before starting the treatment. But yeah, hopefully we are working on some one day to hopefully sooner rather than later to have also finance options. But at the moment, they're not available.
Thanks. Hopefully someday we'll be able to bring that in. That'd be great, Oriel.
Hopefully.
Yeah. With that as well, so do these programs, does it include all the monitoring scans before and after an egg retrieval and an embryo transfer?
So yes, the monitoring scans and the blood works as well that you will have before the egg collection and the FET, those will be included. So those will be the ones that to monitor your cycle, your fresh cycle or your frozen cycle. Those ones, they will be covered.
Brilliant. Thanks for that, Oriel. So just give it a minute or two if there's any other questions in, and then we'll just see if anyone has anything else. And like that, if anyone has anything they'd prefer to talk about offline or they'd like to speak with Access Fertility, I have popped their website into the chat as well, accessfertility.com. So if anyone wants to reach out and talk in more depth directly with the team, or learn anything else more specific that they're happy to talk about offline as well, that's absolutely no problem.
Can I say one more thing, Katie?
Yeah, of course, yeah.
So I want one thing that I always say, and I think for us it's very important, is I want to encourage all of you to ask questions. Sometimes when you go through, probably some of you already went through IVF treatment, some of you it's the first time that you are looking for information. So it's very important, super important to ask questions and for you to understand every single thing you are doing. So in terms of the programs and Access Fertility, when you contact us, if you're interested, please feel free to ask as many questions as you need. And if you ask a question and you don't understand still what we are saying, that's completely fine. Ask the question again, and we will be happy to explain it in a different way or something like this. For us, it's very important that before you start the treatment, you understand absolutely everything. So you focus only on your treatment and you don't focus on how much it will cost me. Is this covered? Is this not covered? It's very important that you go as stress-free as possible to your treatment and you focus on your treatment.
Yeah, no, definitely. And the same as well for SIMS patients, as Oriel mentioned, this is applicable to all the SIMS clinics in Ireland. So again, if anyone has any queries or wants to speak with the admin team as well, they're more than happy to talk through Access Fertility in relation to your treatment as well. Brilliant. Well, I don't see any other questions popping in, so I think we can leave it at that. And again, if anyone wants to follow up directly, that's absolutely no problem. So thank you, Oriel, for jumping on and going through the programs. We really appreciate it. And thank you for your time.
Thanks everyone as well for being here. And thanks, Katie. And anything else that anyone needs, happy to help anytime. Okay.
Thank you. That's brilliant. Bye.